your nose imposes a resistance to your breathing to slow down your breath, and mouth breathing, there's no real resistance. So you're going to take a larger viral load, and that'll make you more susceptible. And I'm not saying that nasal breathing and light breathing will stop COVID, but it should reduce the viral load.
Welcome to Breath, a new science of a lost art expert Q&As. We are once again talking about COVID, how best to breathe during this foul pandemic. The expert today is none other than Patrick McKeown. He is a world-renowned breathing expert, a best-selling author, leading authority in the field of breathing for asthma, anxiety, rhinitis, and more. McKeown is the founder of Oxygen Advantage, a training program focused on athletes. Read all of McKeown's books early on while researching breath and learned so much. So bios aside, let's get right to the questions. The first question from Maury: I have to wear a mask all day at work and I hate it. Is there any healthy way of breathing while wearing a mask? Patrick?
How you react in terms of wearing a mask is going to be influenced by your sensitivity to the gas carbon dioxide. In very simple terms, when you wear a mask, you are exhaling into the mask, and the gas carbon dioxide is pooling in the mask, and carbon dioxide is the stimulus to breathe. So if you have an overly sensitive reaction to carbon dioxide, the air hunger that you feel is going to be a little bit stronger. Now, the risk with that is that if you feel breathless or if you feel air hunger while wearing a mask, it may cause you then to breathe faster in upper chest. And that in turn is going to be very inefficient and very uneconomical. So how to wear the mask is a little bit of a long story, but here's a few things. If you breathe through your nose all the time during both wakefulness and sleep, and also if you practice slowing down your breathing during rest and exposing your body to a little bit more CO2, this in turn will reduce your sensitivity to carbon dioxide. Then when you wear a mask, you'll be better able to tolerate it. And the other thing is, when you are wearing a mask, don't breathe through an open mouth, because mouth breathing is typically linked with the upper chest. For example, if you were to look down at your chest, and if you take a breath through your mouth, you'll see that breathing through the mouth activates the upper regions of the lungs. But in terms of lungs, we're talking about the greatest concentration of blood is in the lower regions. So in order to ensure a better gas exchange from the lungs into the blood, in other words, when you take air into your nose and that air is passing down your throat, into the bronchi and into the bronchioles and into the small little air sacs, we have to be able to breathe low. And we could also use the word breathing deep here, but it's not taking a big breath, but it's having a combination. It's looking at 3 dimensions of breathing. Light breathing, in other words, don't overbreathe, because this causes your blood vessels to constrict. Slow breathing, because it's more efficient, and low breathing. And that's going to be in terms of wearing the mask. So at the start, you will feel a little bit of air hunger. Continue with it, and I'd say gently expose yourself with it. So maybe the first day, put it on for 15 to 20 minutes. Later on that day, put it on for 20 minutes again. The next day, put it on again. But the feeling of air hunger is not because your blood oxygen saturation is dropping. And I'll just make that now, because you will see a small drop to your SpO2. And the reason being is, as you wear a mask, carbon dioxide will increase slightly in your blood. And as carbon dioxide increases slightly, your red blood cells release oxygen more readily to the tissues. And when your red blood cells are releasing oxygen readily to the tissues, you will see a slight drop in the SpO2. But don't see that as a bad thing. It's not that wearing the mask is causing hypoxia. It's that the increased CO2 is enabling a better release of oxygen from the red blood to the tissues.
Excellent. From Laura: how should we breathe if we're surrounded by other people, such as on an elevator?
Well, Laura, it's 2 things here we need to consider. One is the dose or the viral load, and the other is the duration. So an elevator ride, it's fairly, it's only going to take about 15, 20 seconds maybe. If you're surrounded by people, and I remember when I was in the tube in London, and I was doing 2 things. It was very, very packed with people there in early March. I did 2 things for the entire duration of the journey. I breathed through my nose, and I breathed hardly any air for the entire duration of the journey. Because again, I want to reduce the viral load that I'm taking into my body. If I take in a reduced viral load, and by virtue of that, by breathing as hardly any air as possible, I'm reducing the amount of load I'm taking into my body. And hopefully then my immune system is not going to be overwhelmed by the amount of virus that I'm taking in. So always consider how much of a viral load are you exposing yourself to. Now, if you have your mouth open, by virtue of being able to breathe larger amounts of air into your mouth, because there's not, your nose imposes a resistance to your breathing to slow down your breath, and mouth breathing, there's no real resistance. So you're going to take a larger viral load, and that'll make you more susceptible. And I'm not saying that nasal breathing and light breathing will stop COVID, but it should reduce the viral load.
All right. The next question from Tom. If someone next to you coughs or sneezes, is there any recommended way to breathe to help reduce exposure?
Yes, stop breathing straight away. Don't even, that's a high viral load. So if somebody coughs, there is a lot of the virus coming out in that cough. That's entirely different than somebody, say, being within a meter of you and are talking. And even talking is going to emit it, because we have to bear in mind it's transmitted airborne, it's water particles. But a cough, you're going to have a lot of particles coming out. If somebody is coughing, hold your breath and walk away.
If we feel symptoms of COVID coming on, is there any way that we should breathe?
I think it's very important that you monitor your blood oxygen saturation. And what I would say to you is buy a pulse oximeter. It is a respiratory condition, and one thing that is it's inherent is that the blood oxygen saturation is dropping. And it's very strange the way it's dropping. It can be dropping quite low, even though people don't necessarily feel symptoms of breathlessness. Always bear in mind, mouth and fast and shallow breathing is completely inefficient. And nose and slow and low breathing is both more economical and more efficient. And with this, what I'm going to do is I'm going to share a screen. Now, hopefully that screen has appeared there. And what we're looking at is, we're looking at here, the first individual is taking 20 breaths into their body. And because the respiratory rate is quite quick, this is in 1 minute, and the tidal volume is the size of each breath. So the minute ventilation, the amount of air that they take into their body in 1 minute is 6 liters. However, even though you're taking 6 liters of air into your nose or mouth, it doesn't mean that that 6 liters is getting down into the lungs, because a certain amount of that air with every breath is going to stay in your nasal cavity, in your throat, in your trachea, in your bronchi, in your bronchioles. And of that, if you take in 20 breaths, half of that will stay in dead space and half of it will enter the small air sacs in your lungs. So it's very inefficient here. Fast breathing, shallow breathing, very inefficient. So the individual is taking 20 breaths per minute, and 50% of the volume of air that they're taking in is reaching the small air sacs in the lungs for gas exchange to take place. And the other 50% of air is staying in their throat, in their trachea, in their bronchi, in the bronchioles. The second example, the individual slows down their breathing to 12 breaths per minute. We've increased the tidal volume proportionately. So in this example, we are still taking 6 liters of air into the body, but because of the reduction to respiratory rate, we've increased alveolar ventilation from 3 to 4.2 liters. That's a significant change. Now, if we were to go one step further and slow down the breathing to 6 breaths per minute and allow the size of each breath to increase proportionately, and when you are slowing down your breathing, just try not to make sure that you're over breathing. So don't let the tidal volume increase disproportionately. This example here, we're taking 6 breaths per minute. We have a minute ventilation of 6 liters, but you see the amount of air that's getting down into the air sacs down. It's increased now to 5.1 liters. That's a significant improvement per minute, and that is going to improve oxygen uptake in the blood. So, really, in order to help prevent blood oxygen desaturation, it's really important, don't breathe fast and shallow. And I'm just going to show you as well another paper to back that up. And this is looking at individuals who were climbing at altitude. And I think it's very important because in this example here, and this is looking at the work of Dr. Bernardi, who is an Italian cardiologist, but this isn't Bernardi's paper. It's looking at the effect of slow breathing at high altitude. These individuals were climbing Kilimanjaro. They were at an altitude of 4,500 meters. And you see before, when they were doing spontaneous breathing, normal breathing, their blood oxygen saturation in the first study was 80%, so it was severe hypoxia. These individuals slowed down their breathing to 6 breaths per minute, and it increased their SpO2 from 80% to 89%, which is mild hypoxia. And in the second study, it changed their blood oxygen saturation. And when I mean blood oxygen saturation, I'm talking about the fraction of your hemoglobin occupied by oxygen. So hemoglobin is a carrier of oxygen in the blood, in the red blood cells, and your SpO2, your SaO2, is telling you of all your hemoglobin, how much of it is carrying oxygen. So in study B, the individuals, their SpO2 was 81%, and by slowing down their breathing to 6 breaths per minute, it increased their SpO2 to 88%. So it's just that slow breathing. And in the example that I gave earlier on, you're not wasting as much air in dead space, but you're breathing lower. And in the human lungs, the greatest concentration of blood is in the lower regions, and also by breathing through the nose. And, you know, if you look at the anatomy of the nose, this is just an anatomical model, so it should be fairly clear. You see the lips here and you see the nose here. And if we look at the mouth itself, there is absolutely no function served by the mouth in terms of breathing. If you breathe air in through your mouth, that air goes straight down your throat. Your mouth does nothing, zero functions. Now, if you look at the size of the nasal cavity, which is sitting above your mouth, you look at the size of that space in the skull, which is designed to serve so many functions in terms of respiration. Any respiratory complaint, whether it's asthma, or even, you know, people with anxiety, people with sleep disorder breathing, people with, you know, COVID, continue breathing through your nose, both to harness nasal nitric oxide, but also if people are infected, also make sure you breathe through your nose, because if you breathe through your mouth, there is a 42% greater water loss out through your mouth. So you can imagine if you are, you know, if you're unfortunate enough to be infected and you're in your family environment and your family members are around you, and if you're breathing with your mouth open, you're emitting a greater load into the atmosphere that could increase the risk of your family members picking it up.
Wow, that was great. Is there a simple way to assess respiratory health? Someone just sitting around right now.
Yeah, you know, since 1975, researchers have used breath holding as a means to determine your sensitivity to carbon dioxide. And it's not just carbon dioxide sensitivity, but it can kind of give you feedback of your breathing in general. And typically it's a measure of breathlessness. In other words, how fast or how hard do you breathe? And the measurements taken from the Buteyko method is as follows. You're sitting down for about 5 minutes. You're just breathing normally. And you take a normal breath in through your nose and a normal breath out through your nose. And you could either just stop breathing, or if you felt more comfortable, hold your nose. But you're timing it in seconds until you feel the first definite desire to breathe or the first involuntary movement of your breathing muscles. And then you let go and your breathing should be fairly normal. Now, it's not the length of a maximum breath hold time. It's literally how long does it take after you have a normal exhalation. How long does it take for your brain to react? In other words, you take a normal breath in, a normal breath out, you hold your nose or just lock your throat, stop breathing, and time it in seconds. How long does it take until you feel the first definite desire to breathe? And your breath hold time, recently it was researched by a professor of physical therapy in the United States called Kiesel, Kiesel. And he found that if your breath hold time is above 25 seconds, there is an 89% chance that you don't have dysfunctional breathing. However, bear it in mind in simple terms, if you've got a low breath hold time of 7, 8, 9, 10 seconds, your breathing is generally faster than what it should be, and it's upper chest. And you will feel a greater degree of air hunger. You might feel that you're just not getting enough air, and you'll also have disproportionate breathing during physical exercise. So with COVID, it's a good indicator, even in general, people with asthma, people with sleep disorder breathing as well, breath hold time can play a role, for example, in identifying loop gain in sleep apnea or high loop gain in sleep apnea.
How could I train myself to increase that breath hold time?
Yeah, I think it's really important to bear in mind as human beings that we were born innate nasal breathers. Our ancestors were innate nasal breathers. The animal world, with the exception of a dog and a couple of birds, are innate nasal breathers. And the only time animals have their mouth open is when they tend to be sick, that they are breathing through an open mouth. Keep an eye on your breathing. And in addition to using breath hold time, also be aware of your breathing. You should never hear it during rest. You know, you look down at your breath. If you see that your breathing is relatively fast, gently slow down the speed of your breathing. And one way to improve your breath hold time would be to take slightly less air into your body. Do your physical exercise with your mouth closed. And even though you feel air hunger, bear in mind that the air hunger signifies that carbon dioxide is increased in the blood. So that's good, because as carbon dioxide increases, by the way, carbon dioxide is not just that waste gas that everybody talks about. It plays a role in helping to open up your blood vessels. And it also plays a role in the release of oxygen from the blood to the tissues and organs, including the brain. So yeah, make it a practice. You could, for example, if you were sitting down in the evening, put one hand on your chest, one hand just above your navel, tune into your breathing, and you tune into the slightly colder air coming into your nose and the slightly warmer air as it's leaving your nose, and gently slow down the speed of the air as it enters your nostrils. So you're slowing down the speed of air coming into your nose, and at the top of the breath, bring a total feeling of relaxation to the body and have a relaxed and gentle breath out. And again, the next breath, take a very slow and soft breath in. So if you gently soften and slow down the speed of the air that you take into your body, carbon dioxide increases a little in the blood because it cannot leave the blood through the lungs. And this in turn then will reduce your sensitivity to carbon dioxide. And as a result, then you have a higher breath hold time.
This is somewhat related. From Lisa, I suffer from asthma and anxiety, especially nowadays. Is there any specific breathing technique to help with these conditions?
Yeah, Lisa, just with anxiety, people can have an overly strong reaction to the feeling of air hunger, and be always careful with doing breathing exercises that when you are gently slowing down your breath and you feel air hunger, if you have an overly strong aversion to that feeling of suffocation, just take a rest from it. So one exercise that you could do to help, because with panic disorder, for example, and high anxiety, I never know until I'm working with the individual in front of me how they are going to react to air hunger. But always bear in mind, what is good breathing? It's in and out through your nose. It's low, so it's driven by the diaphragm. And as you breathe in, typically if you had your hands on either side of your lower ribs, as you breathe in, your ribs should gently move out. And as you breathe out, your ribs should gently move in. The respiratory rate should be slow and the breathing pattern should be light. Now, contrast that to how many people with asthma and anxiety breathe. They often breathe, well, with asthma, there's a tendency, because there's inflammation of the lungs, that inflammation can travel up to the nose. So nasal obstruction is more common with people with asthma. And if your nose is stuffy, you tend to mouth breathe. And if you mouth breathe, you tend to chest breathe. So you see, with asthma, it's like that vicious circle. It's a feedback loop. And also with anxiety, because if, for example, you are breathing fast and shallow and you have a strong reaction to CO2, that feeling of suffocation can initiate and feed into the symptoms. So I would say go very, very easy with it. Switch to nose breathing all the time. Bear in mind that, the little feeling of air hunger is just that CO2 is increasing in the blood. Do your physical exercise with your mouth closed. And if the air hunger gets too much, just slow down. Let your nose determine the intensity of your physical exercise, the pace. And your breathlessness during physical exercise, it will depend on a couple of things. If you have a nose like mine that's absolutely totally compromised, you see one nostril smaller than the other, you might have to use nasal dilators, mute snoring or breathe right strips or something to help open up the nose. But yeah, I would say become more comfortable with your breathing, observe it, and gently make a practice of gently slowing it down. And also, as you're doing that, have your hands either side of your lower ribs. And you could breathe in 2, 3, 4, 5, out 2, 3, 4, 5, in 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5. So if you're counting in for 5 seconds, time it on a watch. You're breathing in for 5 seconds, you're breathing out for 5 seconds. That stimulates what's called baroreceptors or pressure receptors in the major blood vessels. And that in turn then is influencing the vagus nerve, which is a very important nerve that's responsible for activating the parasympathetic response in the body. So to improve then what's called heart rate variability, but heart rate variability is kind of a measure of stress in the human body. And you can influence that by having a cadence of your breathing. And what I mean by that is a respiratory rate between 4.5 to 6.5 breaths. So typically about 6 breaths per minute. So just have it in the back of your head then. Don't breathe fast and shallow through an open mouth. Breathe nose, breathe slow, and breathe low.
I got this question that I could not answer. It's the first time I've heard this. This is from Susan. I suffer from very low blood pressure. You mentioned that breathing can lower blood pressure so that it might be harmful if I breathe slowly.
No, not necessarily. The strange thing about the baroreceptors, so these are pressure receptors inside the major blood vessels, and they are monitoring our blood pressure continuously. And if our blood pressure increases, the baroreceptors will respond by sending an immediate message to the blood vessels to dilate and the heart rate to slow down so that blood pressure normalizes. However, if our blood pressure drops, the baroreceptors send an immediate message for the blood vessels to constrict and the heart rate to increase to normalize blood pressure. So what I would say is look at the relationship between put in hypotension, low blood pressure, and heart rate variability biofeedback. And we have seen individuals with low blood pressure normalize their blood pressure by slowing down their breath to 6 breaths per minute. And I would say that there's some research out there. Like always, I'm always intrigued because in terms of slow breathing, what we do, most of the research is always evolving around heart rate variability biofeedback. And once you increase the sensitivity of the baroreceptors, that your automatic functioning of your body is working better, it could play a role there in terms of helping to normalize blood pressure. So I would say don't be worried about doing slow breathing. It's really, really beneficial. In and out through your nose, low and slow.
This next question is way off the COVID topic, so we might even just cut this out of here. But let's see what happens. I thought it was really interesting. I had no idea how to answer it. So it's from Henry, who is in his 70s. He's very fit, and he was recently diagnosed with AFib. He had a successful ablation procedure for AFib, but got curious from the intersection of breathing and AFib. The ablation procedure for AFib isolates the pulmonary veins coming into the atrium because these veins tend to be the source for unwanted electrical activity. AFib is highly correlated to sleep apnea. It's also correlated to high blood pressure. So can you provide any context on this, on how the pulmonary veins are the major source of AFib? That's interesting. And how that might be related to breathing and possibly even what he can do with this condition.
No. But what I'm going to say is, though, when I hear of somebody coming in with AFib, I'm always curious about their sleep. And I think really, what we're talking about AFib, we're talking about the electrical conduct, or we're talking about the timing, the rhythm of the heart. And it can be influenced by your breathing. If you breathe hard and fast, for example, it can cause various ECG changes, but also sleep apnea. And I would bring this in is that breathe in and out through your nose during sleep, and also practice low and slow breathing. Improve your breath hold time. So sleep apnea now is getting a lot of attention, and more so in terms of breathing, because there's now a recognition that it's not just an anatomical issue. It's not just that the airway is compromised. There's 3 now non-anatomical phenotypes. One is called loop gain, and that refers to the sensitivity of your body to carbon dioxide. For example, if you have a strong sensitivity to carbon dioxide, your breathing tends to be fast and hard. And if you stop breathing during sleep, when you resume breathing with very exaggerated ventilation, and this blows off. You go from a state of high CO2, hypercapnia, to low CO2, which is hypocapnia. And as a result, then the brain doesn't send the signal to breathe. And also the output from the brain to the upper airway dilator muscles is reduced. So without going too technical with it, there is a role for your breathing in terms of sleep apnea. And do some research in terms of if you reduce the AHI index, which is a marker of your severity of sleep apnea, could that have some impact on your AFib? So I'd be always more curious on that role. And from what has happened in terms of the venous return to the heart, I don't know. I can't offer you an opinion.
Last question here. Again, not directly correlated to COVID at all, but I'm going to ask it anyway. So good old sleep tape, mouth taping. I have had very good experiences by just placing a teeny piece of tape. I'm cheating here. This is blue painter's tape that happened to be on my wall, but I just place it right here, middle of my mouth. I can still talk. I can still breathe out of my mouth if I want. Just trains the jaw shut. I know that so many other people that I've talked to who have had chronic snoring for decades and decades use this and they're like, oh my God, I'm not snoring anymore. So I had more recently understood that you have a different kind of sleep tape, I guess I'll call it, specifically designed to make this easier for people to do. Some people don't like this. I like it. I think it's fine. But by any means to keep people's mouths shut at night is a good thing. So if you could just tell me a little more about your version of sleep tape.
Yeah, we've been using tape for 20 years, and we've been using it for children both during wakefulness and also encouraging children nasal breathing during sleep, and many adults, thousands of adults. And some adults are apprehensive about wearing tape across the lips. And of course, with children, how do we ensure nasal breathing? So the idea of the tape was to surround the mouth with elastic tension to gently bring the lips together. And I'll just kind of show you an example of it here. So this is the adult's version. So it's cotton elasticated tape, and I'm just pressing it around the mouth. Now I stretched it about 30, maybe 40%. And by stretching it, there's a resistance now that it's bringing my lips together. But say, for example, a lot of people that we work with are people with anxiety, and they're always going to be apprehensive about taping their mouth. That's fair enough. At least this now, we can get nasal breathing, but they know that if they need to open their mouth, they can open their mouth. And, I would always say to the clients coming into me, if you wake up with a dry mouth in the morning, you are not waking up feeling refreshed. And your book threw tremendous light on that, because it's something that we've seen all over and over. And I think it was a great idea that yourself and Olsen did the experiment of going around with your mouth open for 10 days. Now, and I was just talking to somebody, I said, yeah, James Nestor, he had his mouth open for 10 days and he was giving out about, I had my mouth open for 20 years. Number one, nobody told me I different. And number two, I was chronically exhausted all the time. And, James, when you look at the literature in terms of the impact that this is having on sleep apnea, I'm just going to show you a paper that was published only this month, because I think it's really important that we look at the impact of open mouth breathing. So I'm not sure if you see this. This was published the Laryngoscope. It's 2020. The association between breathing route oxygen desaturation and upper airway morphology. Now, I'm just going to scroll it down, but basically the conclusion was that mouth breathing was significantly associated with worse oxygen desaturation and increased degree of upper airway collapse. Therefore, patients with mouth breathing, that goes on about anesthetists. One moment, and I'm going to scroll down here. I'm not sure if you can see this,
yes,
but the AHI index, the events per hour with mouth breathing were 52 events per hour, which is severe. And with oronasal breathing, so that would be individuals switching from nose to mouth or breathing through nose and mouth at the same time, the AHI was 42 events per hour. Now with nasal breathing, the AHI was 27 events per hour. So there's a remarkable difference between individuals who are either mouth breathing solely or switching from mouth to nose breathing, vice versa, throughout their sleep, or nasal breathing. But even looking at this, the minimal SaO2, this is the drop to the blood oxygen saturation, With mouth breathing, it dropped down to 64%. Now, if we did this during wakefulness, this would be almost an impossible thing to do. And I've seen it with athletes. We have athletes do breath holding to drop their blood oxygen saturation. To get them down below 70% takes a lot of work. This is severe hypoxia, and this is extreme stress on the individual during sleep. So with mouth breathing, it was 64%, oronasal breathing 77%, and nasal breathing alone 78%. So, you know, for sleep, there's just no comparison. And here's the thing, men, we are more susceptible to obstructive sleep apnea. And when we are over 40 years of age, we are 6 times more likely to spend at least 50% of the sleep time breathing through an open mouth. And it's no wonder we are waking up exhausted. And it's not just that, it's erectile dysfunction as well. But like, that's, if you want, you know, tape your mouth, close your mouth.
That paper, I had not seen that, and it just supports exactly what we experienced. Right from the get-go,
Totally.
within a day, we start snoring, sleep apnea. Right when we start nasal breathing, it all went away. So extraordinary stuff. I want to thank Patrick McEwen, excuse me. I'll try that again. I want to thank Patrick McEwen for his time and wisdom here. If people want to learn more about your work, where can they go?
Yeah, we've got 2 websites. buteycoclinic.com is for people with sleep apnea, anxiety, and asthma. And then oxygenadvantage.com is for athletes and sports performance. And then we're on Instagram as well.
Thank you, Patrick.
Thank you very much, James.